Well, hello there, Stephanie.
Hello, Miss Tina. How
I
are
have you
you?
back, my co-founder of the
Yes.
Long Island Breakfast Club.
Nice to be here with you. Sorry Greg's not, but happy to be here with you just the
16
same.
years ago, when we were looking for jobs, we met each other in the hallway of the Long Island Association.
We were both there for the same
Same
job.
job, a big, big job, and that's how we met.
After running we saw each other in a couple of jobs, so then we figured they would just call in, a certain age group that they could check the box. Oh yeah, I interviewed them. I'm going to go with a 20-year-old. So we went out to a breakfast one day after that, and apparently stayed too long and got thrown out. But
And the rest is history. We became
the Long
famous
Island Breakfast Club.
because of the diner on 110 that threw us out for spending too much time and not enough money.
Exactly.
So 16 years later, here we are at our brand new studio.
Beautiful.
And
Absolutely.
Bobby Lacera from Strong Island TV is engracing us with teaching us more now that we're in a much better technological studio. It's beautiful. Thank you, Bobby. And I want to introduce first my guests. I have Eileen Karina from the Pulse Center for Patient Safety Education. Thank you for coming.
Thank you.
And I have Vicki Eleanor, who is just about everything, outreach, community. What else? Just name a few things you do.
Well, first of all, notably, I'm a nurse by background, and my nursing career has taken me in different directions. I've worked in different disciplines, hospitals, nursing homes, assisted living, etc. I'm a founder of a not-for-profit that I ran for about 20 years, dedicated to senior issues and advocacy. Today, I divide my time proportionately in different areas. I do outreach and government affairs
Right.
for businesses and not-for-profits. I also still do advocacy, and I do, actually I have a house call practice with a physician where we see homebound seniors who can't get to doctor's offices.
Okay.
So actually back in 2018, when I was kind of figuring out the next step of what I wanted to do, and I thought maybe I would retire, like those words sounded so interesting to me, retire. But time went by and I said, you know what? I went to a meeting, actually somebody who you know quite well was a speaker, and it just, like my brain said, oh my God, you know what? I don't want to retire, I want to rewire.
That's I like that. Don't you like that?
Yes.
That's not, don't
We've
retire,
heard
you
that.
rewire.
Yeah.
So that's
That's
kind
a
of
good
where I
one.
am in my life, professionally and personally.
All right, well, we're going to talk more
yeah.
about it. But today, of all days, guess what it is today? It is National Milk Day. So everybody go buy your quart of milk and make you smile. Put your milk all over your lips like the men do. And National Bittersweet Chocolate Day. And my friends here brought me bittersweet Ghirardelli, so we're going to be eating that.
Nice.
And it is also Jennifer Canzoneri's birthday, who's part of the club. So happy birthday, Jennifer. But the first thing we do here is we salute. We have wine, everybody. We have some
Yes.
nice white wine that Patrick gave us today.
Thank
So-
you, Patrick.
Let's just salute to today. Is a beautiful day. Sun is shining. And I have three powerful women sitting here with me. And I really appreciate you coming. So thank you.
Salute.
L'chaim.
So, Vicki, you're doing so many different things. So let's talk about your newest thing, which I know you told me the name of it, and I like what it sounds. Insight Strategies?
So, I mean, the backstory on that, it really is not, it really is, what is that phrase, not ready for prime time yet?
Right.
But I am looking to rebrand what is now called Elder Factor, which is the medical care management and the advocacy part of my business, and the physician house call practice, which is called Door to Door Doc. So, I'm in the process of doing that. So it's just a tinge premature.
Okay.
But it's actually a name that the name that I have in my head is a name I wanted to use years ago, basically still doing the same thing. The medical case management part of what I do is with the physician, we go out and we manage cases typically in the home, or it can be a situation where we get calls, somebody's in a hospital or in a nursing home, and they need professionals for
To go
whatever
when they go
reason.
home.
Well, not even when they go home. They might be, I just recently did a case in a nursing home where the family they were not getting the answers that they wanted. There were things that they were confused about, and they really need the professionals to go in there and to help them sort through that and sift through that out. So that's, part of what I do.
Which is really important. I mean, I know, because I lost a few people, and many times when this happened, I would call Eileen because she was a wealth of information. But again, if you yourself don't have the knowledge, the chutzpah to do it, and you don't have a daughter, if you're the patient, you're dead. You know, you can't
When you have the
help them.
doctors go with you, do you go through insurance, it's covered through insurance?
Good question, okay? When we do the medical care management, it's on a consulting basis, and that's fee structure. It does not go through a insurance, Medicare or private insurance.
It's like a consultant,
But when the doctor
right?
comes to the home, when you
The
do the doc
home is
visits.
different. We're talking about two different things. So with the medical care management that we do, like we're going into an institution for some reason, somebody calls us, he does not have the capacity to treat or assess anybody other than going in there doing his knowledge based on medical records and dialogue with the family and with the patient, and to go through and see what is going on and how we can be helpful in any given situation. Different animal. Now going into the home is something different. Medicare in certain instances, if someone's a Medicare beneficiary, we'll be able to bill through Medicare. So it's a short answer to a very potentially long
Complicated.
question. But if anybody is ever interested in knowing about that, happy to enlighten and to certainly educate people. We are so indoctrinated in this country, of course, that we get health care paid through insurance. Sometimes insurance can only go so far, and if you really have a complicated medical issue, and it could be really life or death, you might want somebody in there who's going to help you get through that.
And I think that's the case a lot lately.
I think so, too.
I mean, people, they're just, grasping at whatever they can to get help of someone that is educated to help them.
And insurance companies just deny the claim, and just deny. It's crazy what's going on, and with the shortage of, my neighbor just got out of the hospital, he needed medicine. We went to a large pharmacy, they didn't have it yesterday, they weren't sure if they were going to get it today. She said, go to a small pharmacy, perhaps they would have a better shot at getting it. We called several, they don't have it. So, I don't understand what's happening in this country. Healthcare is really, I
Scary.
appreciate what you do and what you do, because healthcare is really in need of a shot in the arm itself.
So you bring out so many things that are prevalent today in the healthcare delivery system and what has happened. First of all, if we go back to the 60s when doctors actually used to come to the house, remember that?
I do,
right?
very
And then they went to an office and we said, oh my God, doctors have offices? And now we have doctors in their offices. And the healthcare system was such that there were community hospitals that were accessible to anybody. If you lived, I was coming down Hicksville Road today and I said, remember the old Massapequa General Hospital?
Doesn't
Yeah,
exist,
no,
right?
Doesn't exist anymore.
Right.
That's what my doctor is.
So I
That's what my
think,
doctor is.
yeah. So that's part of it, and the trend is the big 3 or 4 have absorbed the smaller hospitals. So you're dealing with that, and I mean the hospital and the doctor experience is so different, and that's what makes people like Eileen and me and people that we work with so important, because people need this type of assistance. Now, they
critical.
don't know they need this type of assistance, or they don't know where to get this type of assistance.
Or they don't know it's available.
Exactly. So, I mean, just doing this today by whoever is tuning in, maybe there's just a aha moment where you say, you know what? This happened to me, and I'll tell you what, if I had X amount of dollars for every time somebody said to me, oh, I wish I knew you when. It was my mother had this, my father, my sister, my brother, etc. I could buy that lottery ticket too.
Absolutely.
And
And
do
I
the
think,
hospitals
yeah.
endorse you?
The hospitals will not endorse you, no.
They don't
They
recommend?
might recommend you to refer. I mean, we are, the hospital system is very different. I think it would take us a lot longer to get into the hospital situation and what happens. First of all, if you have a big hospital system, basically they're gonna refer internally.
Of course.
Yeah, but what about the social workers? Don't you reach out to them to refer you, or no, not really?
Of course you can.
Right.
And social workers, if they are in tune to you or, and they might have a referral list also.
Right.
I mean, because they can't do everything.
No, but I know my experience with the social workers, which wasn't great.
Mm-hmm.
And I fought and fought for my husband, and they didn't listen. And I did the paperwork and fought it again, and they sent him home anyway, and he passed away. But again, it's like, yes, I have a brain, so I figured out how to fight. But if I didn't, and what about these old people that don't have that brain and don't have the children? They need people like you.
Yeah, well, that's what makes us,
Unique.
unique or, or necessary in
Right.
certainly.
Unvaluable. We appreciate what you do.
Right,
Very much
definitely. So now you're also on the board of directors for Visions.
Yes.
Yeah, so
that's
what
new.
is- now that- what is
I sound
that?
surprised because it's fairly new.
Yeah, because I saw that was something new, and that's what I
Yes.
wanted. What's Visions?
So Visions is a not-for-profit organization that deals with eye disorders, visually impaired, and they're a wonderful organization. Actually, Visions was a member of my organization in Brooklyn, their New York City chapter, which is their main chapter. This is the Long Island and the Queens chapter. And I feel really passionate about it because first of all, I was looking to sit on a board, and it just came about at a time where
Good
it felt
time for
right.
you?
Yeah, where it felt right. So yeah, they're a wonderful organization.
So you
Yes.
should have them, reach out to me.
I will.
Yeah, because
I
that's
will.
something,
They would love that.
again, I'm not that old, but I see I'm starting to lose vision, and I put it off,
Mhm.
and I'm sure they have a lot of good speakers that could talk to people about that. I mean, I do a lot of speaking now, and I mean, even as something as safety as far as CPR. I speak on CPR because my sister, she has a training
Yes.
facility, QS2 training facility in Baldwin. And when you ask 50 people in an audience if they know CPR, very few do.
Yes.
So
it's
that's
true.
another need out there
Mhm.
because I think people, what do you think, are afraid to work on someone in case they get sued.
That's
People
part
are
of it.
afraid.
That's part of it, but also, first of all, as a nurse, we take CPR training.
Yes.
Basic and, right now I'm not gonna have a senior moment. But also, with CPR, and I'm gonna tell you a personal story about CPR and about, sudden cardiac arrest, everything. CPR is so important. Everybody should be trained in CPR, at least basic CPR, because statistically, the person that needs a CPR could be your spouse, your sister,
Right.
a family member, happens at home, and people are helpless.
And
So,
yes, and you'll
right,
save the life of someone you love.
Right. So my story is a personal story. My two brothers, they were out in the Midwest, and they were together at one of the stores out there, and my oldest brother walking down and just passed out cold. All right, went into cardiac arrest. It just so happened that the retailer of the store that he was in, they had a AED on site, automated defibrillator,
Right.
and every staff member there has to take CPR.
Right.
So they were able to at least use CPR till the first responders
Exactly.
came. So I will tell you that CPR and all these things really do save lives.
Absolutely.
Oh, of course.
They definitely
Yeah.
do.
Mhm.
But it's unfortunate that, it's not mandatory like teachers are supposed to have it. Daycare's mandatory.
Yes.
Because my sister does the route for all of
Mhm.
Nassau, Suffolk, and New Jersey.
Mm-hmm.
But teachers in high schools, they don't have to be.
Mm-hmm.
Gym teachers do. But that's something that also needs to be fixed.
Mm-hmm.
So, but anyway, part of this show is sponsored by QS2 Training and Consulting. Liz Box, she's in Baldwin. And if you guys need any training or want to get a staff trained, you just call the show and we'll hook you up. So now also I see, because I like all these little things I'm reading about you. You were in Ask the Expert column, and it was all about careers.
I was in, I'm
Ask
sorry.
the Expert column, you were recently
Oh,
featured
yes.
about,
Yeah.
in health, about pandemic and how you would think your career after the pandemic.
Okay, the story with that, going back to what I mentioned before, that time when I was kind of thinking about retiring, and the pandemic, yes, you know, in 2000, well, this started in 2000, it was 2020. Yeah, I started to think about what I wanted to do. So those two are not necessarily connected directly.
No,
But
they are.
through a referral, yes, I actually was interviewed, you know, for that.
Yeah.
And the line there was, I have all these little lines, right? Not done yet. That's how I felt. I'm not done yet. So it was like rewire instead of, you know,
Yeah.
and also not done yet. And I do feel, you know, even at this point in my life, I feel really vital and love the act of being out there professionally
Definitely.
and feeling that I'm doing something that's worthwhile and important.
Well, I'm still not done yet. Are you?
No, I'm dying to find something to do.
How about you? How about you, Eileen?
Friends asked me, I told some friends that people I know my age, they're all retiring and they're enjoying themselves and they're traveling, and my friend said, what would you do if you retired? I said, what I'm doing now, I wouldn't retire.
Well, that's because you love what you
I
do.
love what I do.
You know,
I'm not done
and you
yet.
know, so
No,
you,
I
now,
would get a job tomorrow. Well, I'm working.
Oh yeah, right. She's getting a job
No,
tomorrow.
I'm working,
Oh.
you know, you're talking about all the services in the healthcare industry. I'm
Right.
working with my daughter's friend who has also started a charity called Nursing Home Warriors. And part of what she does is a lot of what you're doing is the advocacy. And she's also started a division of it which is called Silver Threads. Because people in long-term nursing homes, you know, after a while, the visitations wane out. And this provides clothes for them that they can get,
Interesting.
so
It's
they
very
can get
nice. You
new,
just
so,
Very
that they,
cool.
so they can get new clothes and things like that because, you know, people forget them and it's really, so that's where I'm focused now.
Yeah, I know. She's leaving me. No,
Ah,
she's not.
we're
She'd
always
never leave.
together. We're always
No,
together,
no.
but
Yeah.
But that particular thing, when you collect clothes, it's a lot. Because we just did a big thing for Big Brothers, Big Sisters. And I'm telling you,
I
two
donate to
vans we had of clothes. We had to drive out to exit 70, met in a diner parking lot, got rid of all the clothes. But we did go to the event in the end, and they were very appreciative.
no, it's time consuming. We're working now trying to get together with a group of dry cleaners. Because she's doing everything on her own with limited funds, so she pays to have things dry cleaned and things like that. So I've gone to a few dry cleaners who are on board that instead of, you know, getting rid, what do you do with the stuff? Well, we just get rid of it. Well, where do you get rid of it? Blah blah blah. Make things a long story short, I have two dry cleaners who are willing to.
That's great.
I said that's the way to go because the clothes are already clean.
Yeah, well, that's very true. And then they're not disgusting when they come. Some people just throw out horrible things.
People donate. You wonder what goes through their minds.
So who wants a Twizzler? Anybody?
Thank you. I mean, I'm always inspired by the ingenuity of people and their passion and how they, you know, foster that and get it out. I think is amazing.
So Eileen, now let's talk about your organization. Okay, the Pulse Center for Patient Safety. I've known you for, I don't know, since you started, right?
26 years ago. I'm
Well,
sorry.
not that long, but
We just celebrated 25 years.
wow. And David Gussin is how we met many years ago, who I adore.
He's
And
fabulous.
I don't get to his meetings enough, but I adore him.
Yeah.
I talk to him all the time, and we refer people back and forth to each
Yeah,
other.
he's a great supporter. A
So
great
first,
cheerleader.
let's talk about what is the Pulse Center.
Well, Pulse Center for Patient Safety Education and Advocacy is a nonprofit organization that started in 1996 as a support group for survivors of medical injury. And we used to meet at the South Nassau Unitarian Universalist Congregation in Freeport as part of the Social Action Committee, and found that people who had bad outcomes in their medical care were able to share their experiences so others could learn. I mean, I started, as you know, from the death of my son,
Yes,
That
which
nobody-
we're sorry that for you.
and that's over 30 years ago now, but nobody said to me what happened, what went wrong, what could have been done different. And when I realized that everyone had these stories after their experiences that we weren't sharing, we were able to discuss what the patient and their family member could have done different to avoid a bad outcome. And that's what our focus has been for 26 years, is educating the public. Bedside advocacy is my favorite thing. We've never charged for our services. And our primary focus is working with the family, because most patients have family members and friends who want to help, but they need the support. So our advocacy is family-centered patient advocacy, working with a whole team to help the patient through the healthcare system.
So, I mean, but you get calls all the time, because I know I call you for people and say, can you help these people? And then it turned into much more, which is your training, how did that all come about?
In 2006, I've been on national patient safety boards. The Joint Commission I was on, which accredits 21,000 healthcare organizations, and the National Patient Safety Foundation. I spent over a decade on each of those boards, and found that there were healthcare providers who supported the work we did, what we did and do, but they don't necessarily come out publicly and say it, because they work for the industry.
Right.
So I asked them to write chapters for a book, not telling the patient what to do, because the patient needs to just get better. I don't believe in telling a patient, this is what you should do. That's not part of our vocabulary. Tell the family member how they can help the patient. And that became a book, Family-Centered Patient Advocacy.
Yes, and I think I have one, right?
Probably, we still have stacks of them in
Yeah.
boxes.
Mhm.
And then it turned into a course, and in 2006, Dr. Leslie Farrington, who was a local OBGYN who joined our board, and I did this training in the community. It started out as maybe 4 hours, and went to 9 hours and 12 hours. And in March, it's going to be 2 days of training.
Yeah, maybe we can show that,
Yes, could you show the flyer?
the flyer of the training you have coming up, which is amazing that it's come this far.
And we've been doing, there's hundreds of people. We have some of the pictures of the people who've taken our course. Medical professionals have taken the course. It's not,
There's the information,
not-
anybody wants to write some phone numbers down and dates.
yeah, and it's pulsecenterforpatientsafety.org is the website where they'll find the information. We want people to go there because we want to build our resources for people to get hired, for advocates to be hired if we know that they've at least taken our training. And our training is only safety. If you're a medical professional, it's nothing to do with
Right.
advocacy as far as we're concerned. We don't talk about health, we talk about health care. The health piece is between the patient and the family and the clinician. We just make sure that bridge is there. If people are using acronyms or using words they don't understand, they're not afraid to say to me, because I'll say, I don't understand what you're talking about,
Right.
very
Mhm.
often. And I don't want to say dumb it down, because that's not a fair term, but if I don't know what they're talking about, it's because I am not a medical professional. And
Right.
if I need to understand it, we don't have HIPAA form signs, we don't have private, because nothing is done without the patient.
Right.
Everything we do, I don't need the medical records, I don't need your medical history. The patient may want it, or the patient's family may want it.
So you're like a spokesperson for the patient, right?
It could be, yeah. if that's what they
Advocacy,
want.
Yeah.
It's a different form. There's so many different forms of there's billing advocates. But ours is safety. And if it really has nothing to do with safety, if everybody feels that they're being treated well and they're getting what they need, well, then they need to find somebody else, because we want to jump in and make sure that the patient is getting the care they need. And the other thing is very important, is that medical errors are the third leading cause of death in the country for many reasons. And the public, even if somebody didn't die, but they experienced a bad outcome, there's a lesson there to be learned. And we want patients to start being responsible for their own safety. We can't just say if something goes wrong that it's all the doctor's fault, it's all the nurse's fault, it's the health system's fault. If you didn't go in there and know your own medications, your own medical history,
Exactly.
you weren't prepared with.
You have to have a list in your
you need
pocketbook
to
where,
be prepared, and
when
we'll
you
help
get
people
ready.
get prepared.
Mhm.
So we have it's called Take Charge campaign, 5 steps for safer healthcare. It's the 5 steps to prepare someone to become a patient. We look at high school children going into college. Their parents aren't going to be able to make decisions for them at 18, 19 years old.
Right.
They need
Exactly.
to be prepared to go off to school, to know their medical history. And you know what I'm bringing into 2024, which is new for me? My 30-year-old son had a stroke in September.
Oh,
Never did I ever think that he needed our past family medical history. So we talk about getting your own medical history. but who in the family has had a stroke, who's had cancer.
Right, so you almost
All-
making a book of your
Yes,
life. in
yes,
this.
and that's what we started doing now for this year, is encouraging people to have the conversation with their family, with their grandparents and parents. What is the medical history? And that I put together for both my kids.
So now when when people leave your class, do they get a
They
certification?
will get, they will, there's a quiz at the end.
So they have to
No,
pass.
Yeah, they have to pass, but we make sure that they pass. We study throughout the 2 days. They will get a certificate, and they can be listed on our website, because that's what we want to do, is build
And then
up
how do
our
they get a job?
resources.
I mean, how does it transfer into work?
Well, people who are already advocates, they may want to take this, and they could be on our website, or people who are retired and want to do this, they could also put themselves out there
And make a little business of
make
their
a
own.
business of their own, or we can now refer people, because right now there's a few different organizations that have advocates. Board certified patient advocates is an up and coming. The last few years have become very popular.
Something
with this.
big.
Uh-huh.
Yeah, and you have to be board certified means you took a test. It doesn't mean that you're good at your job. It's like a doctor. Just because I'm a doctor doesn't mean I'm good at being a doctor. So board certified patient advocates now need continuing education, and we are authorized now. Our programs, which we have 3 a month, are giving continuing education to board
But you've
certified
grown
patient
so,
advocates.
so much.
Is there a cost to attend this?
No, it's free. Well, for the certification for board certified patient advocates, we ask for a small fee
Donation.
for to
Mhm.
$20 or $15 to get the certificate. Otherwise, there's no charge for any of our.
So how do
programs.
you survive? On donations?
With
from
donation sponsors.
Nonprofits?
Every year we do a symposium, and that's a charge. It's $125 for this 2 days, which includes a networking event Thursday night, and meals. So it's not a lot of money, but we do have a couple of great sponsors who are helping. And actually, Greater National Advocates, which houses a lot of patient advocates, is sponsoring the possibility of people getting travel scholarships. So they're helping with some travel scholarships, because we want people to come throughout the country.
Oh, so people can come and they'll pay for their,
Well, there's an application process,
Okay.
but we're hoping people will come from around
that's
the country.
terrific.
It's fabulous.
You grew it, I mean, you've grown
Yeah,
tremendously.
we're all volunteers. We're not-
And
we
what
have
is this
no-
whole thing with being national? That was a big thing.
Well, that happened because of COVID. We used to, our groups, our meetings used to be at the diner or, at local
Right.
places. And then when we went virtual, our 3 programs a month with great volunteers who run the programs are, David Fielding is one, who's a patient advocate, and Karen Isaacs, some people know, she's on
I know
our
that
board.
name, yeah.
Yeah, she's 46 years, I think she's doing this. She runs one of our programs. So we have these great volunteers who are running our programs, and they travel to get, to meet the advocates. They're out there doing this. So
Amazing.
we share experiences.
Fabulous.
We share
Fabulous.
information.
So now why did you bring us, I know why you brought us candy, because you know I love dark chocolate. But
Well,
why did you bring
this-
rizz?
It's Twizzlers, it's not just
Twizzlers.
licorice.
Yeah, please.
Well,
You're obviously not a connoisseur of
We
liquor.
don't-
No, well, I don't eat that much.
We don't like to tell people what you should do. You're not going to hear me say, you should tell the doctor, you should do this. You tell the doctor to wash their hands. That's a hot one, right? Who wants to tell the doctor to wash their hands? You
Oh.
sit there naked and they're wearing their white coat. But what happens in the hospital is when you ask the nurse or doctor to wash their hands, and they always say they did already, we found that if you offer them a Twizzler to do it again, they always do it.
So I'm reading this. It says, thank you
Thank you
for washing your hands.
Please help yourself to a Twizzler as a thank you. And we've done that with any kind of candies, all kinds of candy you leave in the patient's room, because it's a thank you. People want to
It's very
That's a
unique.
great idea. And nurses doctors are
And
always wanting
sometimes
something.
the doctors might say, I don't eat Twizzlers. Give it to the nurse, and then you see them walking around with Twizzlers in their pocket. We've done it with candy canes, but you see them all in their pockets. You wash your hands, so we were able to thank them.
That
That's
was
a great-
a
that's a
very
lovely
good,
idea.
And
kind of
lottery
gig.
tickets. Carry $1 lottery ticket as a thank
Well,
you.
I do
is-
that a lot. I do
Yeah,
lottery
so,
tickets, yeah.
but in the hospital, they don't get enough thank yous, and they're doing such an important job that we need to remember to thank them. We need to remember to be empathetic to the workers. This is not about us versus them. We're all in this together. So, by being kind, I have a lot of patients that have said, I told the doctor, I yelled at the doctor, the advocate was there, I was
Yeah, there's
my
always a lot of
husband's
negative.
advocate. Well, once you yell at the doctor, you've closed the door. We don't want you, we don't want you yelling. let's have a conversation, and it'll go and apologize, and let's talk about how we're gonna take care of the patient.
It's almost like you're a counselor,
Always a lot
a
of that.
psychiatric,
And we learn
like
that
a
in the
psych
training.
counselor.
There's a lot of that in the training we're gonna be doing, because a lot of it is about listening and diffusing a situation. Remember
Which,
that it's
yeah,
scary.
in any business, you have to diffuse
Yeah,
things.
and it's scary to be a patient in this big, scary place.
Yeah.
That, whether it's a doctor's office and you're sitting there naked for an hour, and you feel very vulnerable,
Mhm.
and then the doctor gives you this incredible diagnosis and says, "Do you have any questions?" Well, I don't know, because I don't even know what you just said.
Yeah, well, I always
Yeah.
say put it into terms I can understand.
Or knowing that you can come back for another conversation in an hour or another day or another week when you have your questions.
Yeah.
And that's why it's so important to have somebody
So
there.
why do doctors? What do you think? Why do when you go to the doctor is the office always so cold?
I don't know if I'll answer that, but I want to dovetail on what Eileen is
That is
saying
true,
now,
though.
because, and these are very real and important factors, is that, I mean, people will not know what the questions are. They'll have to digest it, or they just don't know. So, I always look at, the admirable things in the organization Pulse, vis-a-vis what, I do with the physician that I work with, because, we do look at, we are asking questions, and we are looking at medical records. I mean, that's what we're there for. I mean, I just had a recent experience with a case that we had in a nursing home, and I'm not going to go into the whole litany of why this gentleman was, why he was admitted there, but the family is saying to him, "We don't understand. This is what's wrong with him, and he's not feeling right. He's weak. He's
Well, then do you
and I'm
require
going
a
through-
HIPAA?
And then I'm going through the. Excuse me, 1 second. I'll get back to that. Yes, the short answer to your question.
Yeah, okay.
Yes, unless the family member is standing there. If the family member is standing there, then you don't need it. I'm going through the medical records, and I see that he's anemic, terribly anemic, almost transfusible anemia. So then it's like, hello, why aren't they treating this? So that's where the element of the expertise, the education, and the qualifications come in with what we do. So I think that there's always the element to look at where people can work together for
Definitely.
the best possible outcomes, because that's what we want, the best possible outcomes.
Definitely. So you're not going to answer the question about
Well-
why doctors' offices are always so cold? You're freezing your butt off, and the nurse doesn't come back, and you're sitting there, and you're
They
sitting
are.
there.
I noticed that. Even
Why does this happen all the time? It happens to me.
They don't want to touch sweaty patients,
that it?
probably.
Maybe.
But what
If
temperature?
if it's too warm, then you're going to be sweaty, and they
Because
don't want to
even-
touch sweaty patients.
Even in the
That's
eye
gross.
doctor, even in the eye doctor when I went,
It's
after my
always cold.
cataract surgery, it was freezing, and I said, and they were all in
Right.
sweaters. I said, why don't you tell me to bring a sweater?
I have to tell
like
you,
the
my
restaurant.
recent
You know, the
experience in
restaurants, you go without a
doctor's offices,
jacket,
I haven't had
and they'll
that
give you a
so
jacket.
far.
You've
I
never
don't
been
have a
cold,
closet
and that
full of
doctor's always
sweaters.
waiting. It's so damn
That's
cold.
what I would
You got
do.
this silly little cape on that doesn't really fit you because they don't really usually bring the big ones in, and it's cold.
Well, when you go into an OR is cold, and the specific
Oh,
reason
that
for
I
that
know.
has to be related to infection
That I
control.
know. Yes.
Okay.
Yes.
So that's why you get a warming blanket too.
Yes,
now,
exactly.
to
Yeah.
avoid the infection.
Yes.
Well, this is also a sign of age when you're cold because I just went and bought 2 heating pads that's sitting on the side of my chair. I have a chair that I watch TV in and plug it in. And, when it's freezing, that's what I do.
But the truth is, when you're talking about this and we're making light
I
of
have one
it,
too.
but keep in mind that when our bodies start changing,
Yes.
make sure you tell the doctor, because there
Yes.
could be something that's brewing
Yes.
there that
Right.
you're thinking, it's my age, but
Right.
it could be something happening, and the doctor's the one to say. And if the doctor says, "Don't worry about it, it has to do with age," you can go another step to a different doctor and
Oh,
ask
yes.
more questions. So, we make light of it, but the truth is that this is how sometimes people find things.
Well, that's true.
That everybody blew off, and that's where the misdiagnosis
True.
of medical error happens.
Right,
And
that's true.
we want to make sure that when I hear somebody talk like that, the first thing I think about when you're saying it's always cold, I'm saying, I'm not cold, maybe it's her.
Yeah.
We have to think about what the next steps would be.
Yeah, okay. So what about I know you do a lot of health eating. I know you're a very healthy eater.
I am.
And you work a lot with putting meals together that are healthy. You're
Yes, I
like a
do.
nutritionist, aren't you?
No, I'm not.
All right, I thought you were, but that's okay. You probably act like one, though. You have a lot of education in it.
So, yeah, I am a very healthy eater and have been for years.
I know she took me to lunch once.
Yes.
This is a very
Yes.
healthy place. I'm
Yes.
like, what am I going to eat?
No
Yeah,
burgers?
yes. And you know what?
No.
I haven't. Okay, I'm going to tell you, I haven't had red meat in years, but there's a footnote to that. So, and I'm going to say this. I'm going to tell you also another part. A lot of personal stories is that I was diagnosed last year with an 80% blockage in my heart. I had to go through a procedure, obviously, and I would say I was the least likely person to have this done. And I had absolutely zero symptoms, zero. Thank God for a very astute cardiologist who, he wasn't picking up on that, with something else, but I mean, he literally saved my life, to be honest with you.
Really?
Because probably my first symptom could have been death, but anyway, not that I want to make us all, excite us all, but anyway. So, I mean, the healthy eating part, which I've always been, it's, I've followed a Mediterranean diet for many years.
So what is that? What does that consist of?
Well,
Fish,
Mediterranean-
tuna fish,
fish,
chicken,
Mediterranean diet, fish,
Mayonnaise.
vegetables, beans,
beans I ate.
olive oil, a lot of fish.
Yes.
I eat very little, if any, red meat and have for a few
Well, I only eat
years.
it once in a while.
I eat
Not
like I'm
often.
still in high school. My husband says hamburgers, hot dogs, pizza's my favorite
Yeah.
food. It's terrible.
It's very funny. I'm on a site with people from Massapequa. We had a shopping center there called Bar Harbor.
Yes.
And do you know that? Yeah. So it's Massapequa Friends, or Friends of Massapequa, and we're having now this little chat. I don't do too many of these things, but I got kind of sucked into this because they were talking about Bar Harbor Shopping Center. When I moved to Massapequa when I was 9 years old, Bar Harbor was like a luxury
Oh, it
shopping
was.
center.
The
all
aisles
right?
was like, the
Yeah,
supermarket was like
yeah.
a Hollywood supermarket. We
Yeah.
actually filmed a movie there
Yeah.
because the supermarket the aisles were so wide.
Yeah. So we're all sharing our experiences and are reminiscing about. Oh my God, we used to go to Pizza Supreme, Saks, Grants, hamburgers, hot dogs, malteds, pretzels, and stuff. We had the worst diets. It's amazing we're still alive, to be honest with you. It's unbelievable.
My
It's so
husband cut
funny.
out of the paper that if you eat a hot dog, what did he say? Every hot dog, remember he told you that too? Every hot dog you eat reduces your life expectancy by 27 minutes. I said, well, then I should be on the other side.
That's right. I don't need hot
I
dogs.
should already be on the other side.
So how are you involved in the healthy part with the eating? Do you help others or with that, or no? You just it's your life. It's your lifestyle now.
Remember, I'm a nurse, so
Right.
I'm not a I'm
Where
not
you
a
go to nursing
dietitian.
school?
At St. Joseph's.
Okay.
I'm not a dietitian. I'm not a nutritionist, but I'm a nurse. And we either learn about it in school a little bit. You learn a lot in school, and then you expand on that,
Right.
So that you can talk, intelligently. I mean, doctors the same things, or sometimes doctors don't want to talk about it because they don't know enough about it. But truthfully, if somebody came to me and said to me, "Hey, tell me about healthy eating," you know what? I feel I'm professionally bound to say, "Hey, listen, I can give you a little bit of advice, but if you really want to know about what is good for you personally, go to a good nutrition, go to
Right.
a dietitian." That's my professional responsibility to get you into the right hands.
Right. No, that's good advice.
Yeah,
And,
no.
we should all take it all the time.
Well,
But we don't. I
I'm
mean,
too
that's
old
the
to
bottom
change
line.
now.
And then as you get older, you get in some habits. I don't know if anybody here does that, but you look for that thing at night. You look for the coffee, or you love one thing.
I have ice cream every night.
Well, ice cream is a big thing too. But the worst thing is if you buy the stuff in the food store, you bring it home, it's there. You'll eat it all. If you don't, it costs you triple if you just go down the block and get an ice cream sandwich at Dunkin' Donuts.
That's true.
So it's gonna cost you either way, because you're gonna eat more if it's in the refrigerator, and if you go down the block to get a quick ice cream, it costs you triple. So what do you
True.
do?
They get you coming and
Pay
going.
me now or pay me later.
Have enough.
Pay me now or pay me later. Oh, an apple.
So
you're good.
it's kind of
You're so good.
interesting. It's just
Fine.
it is what it is. So let's talk about your book a little bit.
My book, we're actually redoing it. We're upping it again. We'll have 3 books out, actually.
Right.
One is Teaching Patient Safety, an Educator's Guide, if somebody wants to teach about patient safety. Then we did family-centered patient advocacy training, and my last book that just came out. Plus, I've written for research articles, which really got me bombarded with mail. But it's called Rants of a Patient Safety Advocate: Stories from the Bedside. I've kept a blog for.
Oh, so you
well,
took down a lot of notes as you were
yeah, well, I
talking with
blog
people?
about my experiences with patients. So I've worked with many different groups of people who have disabilities, don't speak English. I worked for 10 years. I got a grant to develop the healthcare quality project, working with different groups of people. It started in 2010 with a workshop of these groups, people who are transgender, people who are drug abusers, people who didn't speak English, and there were 13 groups, and then we spread out to see what is it about them that keeps them unsafe in the healthcare system, specific to them. So people like lupus, we worked with a group with lupus, and it turned out, for an example, that they were being misdiagnosed constantly. So when I asked why, how do you describe your symptoms, they were very exaggerated. I'm always tired. I can't. Everything hurts. So let's decide, and we developed something called the STARS. S is for symptoms, T is for treatment, everything you've done already. So the STARS card, you could write out before you go to the doctor all your symptoms. So you're not just saying everything hurts. Let's be more specific. And
So
then we
when
do
you
that in
go, you're
schools.
prepared.
Right. So we've learned this from people who are living the situation, and we could spread this, of course, over to everyone. People who are in wheelchairs. We work with the Long Island Center for Independent Living, and people who specifically were in wheelchairs. They have very different needs.
Yes.
A lot of people think, well, they're in a wheelchair. This is what they need. No, they have very different needs. Some are in a lot of pain. Some feel no pain. They're all different. So treating people as individuals, and their fear, it turned out very often, was the loss of their equipment in the hospital. Their wheelchair would disappear because it would go with the rest of the equipment. So one of the hospitals we worked with on this project developed cards that would go on the wheelchair that's saying
That person's.
it belonged to a person. It was not a hospital wheelchair.
Because they come in with their own wheelchair.
Exactly, or walker or cane or whatever it is, and
Right.
it would disappear. So they came up with a plan on how to fix that. So we've done this for many, many years. It individualized the care that people need, but we also feel very strongly about, and then I write about it, and that's what the book is about.
Yeah.
Taking some of the stories, because it's well over 10 years, hundreds, probably over 300 stories and articles that I've written about bedside experiences
Yeah.
and what that's been like. So my passion,
Interesting.
if I could do it every day, would be to run to the hospital, to be at the bedside, because policies and standards are set in the boardroom where the injuries are happening at the bedside. And I've said to many medical professionals, run in the hospital, go take your tie off and go sit at the
Yeah,
change
well,
of shifts and see what's really happening.
Even in the hospital now, I don't know if
Yeah.
you feel like this. The nurses, I love nurses, but they're so bogged down with paperwork. And they can't get to you.
But the trend of our hospital delivery system, our healthcare system, is very different. I've said that before, and it's true. There's and there is that element where your RNs, etc., are doing a lot of paperwork and
It's so
things like
unfair
that.
to them.
But I have to tell you, I was in ICU last year, and I had a really amazing hospital experience.
Well, that's good to hear.
Yes, I did.
Because sometimes you do,
Yes.
And the other thing that I worry about too much is the assisted livings, And with everything that went on in the last year, I mean, you know what happened with people. And my own husband, was in one of the best, I was told. And he didn't get the care he needed.
Mhm.
And I knew people. Didn't matter.
Yeah.
You know what I mean? It doesn't matter because
Well-
there's only so much they can do.
You know what? Sometimes these things is not in our hands; they're in God's hands, and that
Exactly.
is a reality. There's no question about it. So and unfortunately, we have to accept that.
Yes,
So,
absolutely.
But listen, there's. As we're talking about these things and the things, I think it's a matter of deciding also when you have to, where you reach out to
Right.
get the help that you
Absolutely.
want. I mean, there's some complexity, and the complexity has happened because of the is it something that at the bedside, or is it something medical, is it, you know?
And
you
which
really
way
have
do
to-
you go? There's 5 hours.
Yeah.
Well, it's also the thing is that, you know, depending on what what doctors you visit and things like that, like everybody else, they're on quotas. And they have to see so many patients, you know, and it's almost, I said to one doctor, I said, I feel like I'm in a psychiatrist's office, and he goes, okay, we're done now. Like, you had your 59 minutes.
You know what the antidote to that is? Okay, this is one of my biggest
Talk slower,
beefs.
I do.
No,
What?
this is one of the biggest beefs that I have as a healthcare professional, all right? Go to a doctor that's not affiliated with
Yes,
Janssen.
that's,
All right, my husband is not, and I will tell you.
And
can-
he's a doll.
He can talk to a patient for 5 minutes or for 5 hours, it's
Yes.
completely up to him.
exactly.
great
My
guy,
doctor
too.
was like that too, that's why
There aren't that
There
many
aren't many
around.
left.
There aren't
No,
that
but
many.
it's
But they
true.
are there. I know another doctor who recently left a health system to go back into her own practice so that she can practice.
And it's
how
almost
much
like-
she
They have more
wants to.
control.
You
Yes.
know,
There's also something to be said for, and I'm not gonna disagree with you,
Mm.
but I also think, I mean, the doctors that I take patients who I'm seeing, you know, a regular person I take to doctors, we've spent so much time with the doctor that I sometimes can't believe that we're still there.
It depends,
We
I guess,
went into
yeah.
into the patient's
does
getting a
depend.
girlfriend and his home life and everything else. It depends on the doctor, exactly. And if you're not satisfied with the care you're getting from a doctor,
Go
change
somewhere
doctors.
else.
Exactly.
But the thing about
Absolutely.
using a doctor from a health system is getting into the portal, because if I go
I
into.
hate those portals.
A lot of people are not used
Terrible.
to them, but I use it regularly for a patient, that I can go into the portal, I could see, I just found recently a mistake that I wrote
Yeah,
to the doctor
Right.
and said, look, this is what you said at the appointment, and this is what's in the portal, because other doctors are gonna see this, and he corrected it. He wrote, oi, and then
Yeah.
he corrected it. But at least I know that when a doctor they're gonna be reading the notes, but I have to check it to make sure it's correct.
Absolutely.
So that's another thing of
Yes,
being
that is.
prepared.
I
Yeah.
found mistakes on my own portal.
Right, so
So I
if-
have found
if you're
mistakes and
seeing-
that haven't been corrected,
if
so
you're seeing
I
many
have to point them out.
doctors, then you may wanna think about using them, that either be ready to print it out to bring to the next doctor, or they need to be able to read it.
Well, how about this one? Okay, I mean, I'm not controversial. I'm very happy. I'm very nice to people, and you know it. I got dismissed from my one doctor's office by the office manager because I was so sick that they wouldn't give me an appointment. So I just went in, and she said, because of the situation, and they had made an error. She said, you are dismissed from this doctor's office. In other words,
What
you
does that
can't-
mean?
You can't go to the
I
doctor.
can come back.
And find their own doctor.
She,
Can
they
you believe that?
they told me I was gone.
You can, first of all, there are healthcare laws relevant to this.
Yeah,
And you-
really.
and
I
you-
said, didn't you
and-
take that oath?
Okay, I'm gonna talk out of both sides of my mouth, all right?
Okay.
Okay, the first is that there are healthcare laws relevant to this. A doctor's just gonna say, I'm not gonna take
Well,
care of
the
you.
office
There has to-
manager did.
You know, there are particulars.
He wasn't around.
There are particulars related. The other part of it is, who would wanna go to that doctor?
I never
Who
went
would want
back.
to? I'd be out of there so quick, it'd be
Exactly.
unbelievable.
And I'd be putting it all over
Well, the
social media.
reason,
right,
no, but see,
exactly.
I don't do that. but
Whoa,
I don't
The
even like when
reason
you
it
wait in the
happened
office for
was
an hour.
because there was an error on the other side that they didn't realize, the girl. And she said that I was badgering the staff. I was sick. They were going to be putting a machine in my house because I had the RSV. But anyway, it's all water under the bridge. I don't go there anymore. But I am, as you suggested, now starting with a new doctor. I have my regular, but I'm starting with one that is not affiliated with the hospital as my GP. Because then I have both. I can
Yes.
get in there if I need quickly.
Right.
Yet when you call the hospital doctors, you're talking to people that are, telling you like 6 months to get an appointment for
Oh,
a
it's
well
crazy.
checkup.
It's like getting married in the old days. You have to pick a church and hope you find someone. Now you have to pick a doctor in a hospital and hope you're sick that day.
And the other thing, which I believe
3
is
months from now, I think I'm going to
the
have a
old
head cold.
saying. Okay, what's old is new. Going to a local doctor, that's old, but it's new. You came up with that. What's
Yeah,
old is new.
What's old is new. Everything
What's old is new
again.
these days, ladies. You know what? Go look at magazines from 50, 30 years ago and think about it.
Makes me sick. I threw out those clothes. I was in Marshall's today and I looked at this lady. We looked at the clothes together and I said, "My God, I swear I had that in high school."
So it's just,
Amen.
it's just different. It is what it is. So how do people reach you, Vicki, if they want? You have a website, an
Put a
email,
Vicky's flyer.
Facebook.
So I have a phone number,
Okay,
amazingly.
which is
Bob,
what?
can you run Vicky's flyer?
No, she doesn't
No,
have
we
it.
don't
I don't have
Yeah.
a flyer.
Yeah.
Sorry about that.
She
My
will.
bad.
I'm rebranding. 516-455-9612.
Okay, and you could find Vicky at a lot of these great events that's how we met and did a lot of things together. And I know you do the Davy Gusson thing, which I don't as much anymore, only because it's just so busy, but I recommend David Gusson.
He's fabulous.
516ads.com always,
Mhm.
and I love him to death. And how do people register, reach you, your website?
The website is pulsecenterforpatientsafety.org. It's all spelled out. The information's on there for the event, family-centered patient advocacy training. There's sponsorship opportunities. With a sponsorship, you get a free admission to it, and we're only taking 50 people, so we're hoping people
So
will
you probably
get,
fill up quickly, right?
Well, I'm hoping we do, and it's going to be, this is the early bird rate is $125 through February 12th. And of course, if people want a career in a patient advocate, this is a great way to start. We have somebody coming to speak on diagnostic errors from Washington, D.C. This is her expertise, and we have some great speakers coming for this
That's
also.
great. So it's almost like, years ago when you didn't have a good background, but you were good with people. They made you go to school at these agencies so you could be a healthcare worker in someone's house, but not healthcare, just really helping them in the house and doing little things. And that became quite popular. They're always looking for people like that.
You're
Home
talking
health
about
aides,
home
yeah.
care
Yeah,
aides.
home care. Now I see all these ads for you could take care of your mom and get paid. Does
That's-
anybody have
that's
information about that?
That's
Yes, I do
CDPAP.
that for
That's
my brother.
CDPAP. That is
Okay,
it.
so how does that work?
Well, every case is individual, so it would be a matter of, I take care of my brother, because my brother has numerous problems, and I couldn't find a home care agency to take care of him the way I thought was good enough, so I said, I'm gonna do this myself. So it's actually my full-time job now, which is not full-time, but this is what I do now.
So you go to the agency,
I work
Where-
for an agency.
and you
I'm
give
hired
it
by
his
an
name.
agency. Right, well, he had to be approved for the service, that
Right.
there was a need, like a home care agency. But instead of hiring somebody whom we don't know, I said, I'll
That's
do
a
it.
great service.
It's
So,
a very good
all of the
service,
yeah.
people
And
out
we
there that are
checks- we
taking
checks have to
care,
punch in and out and on a clock, and there's people that check
That's
in on
great.
us, so it's
That's
a
great.
wonderful service.
It is. It's reassuring for
But
everybody.
it's also, everything I've been doing is very different than being an advocate for strangers.
oh
It's
yes,
very
it's your
different,
brother,
and it's
family
really
is
been-
family.
It's been an eye-opening experience for me to be on this side of
All
it.
right.
As well as the other side. I leave him and then I go home and work on
Well,
Pulse.
And
Thank
just
you
a-
both.
And just a final word on CDPAP, because it is a wonderful program. CDPAP is for, you can have a family member, a neighbor with anything but your spouse. You cannot have your
Right.
spouse.
Or
as-
parent.
So you guys
as
should,
a
out
spouse,
there,
that's what I heard.
you
That's
gotta
all
look
I know
into
that.
these programs because, you could be having a cousin take care of you, helping her at the same time she's helping you.
Mhm.
There's
It's
a lot
getting
of
a
things I
little
just
bit-
learned this past
But
year.
we're starting to get close to the end, so what I would like to say is thank you, girls.
Thank
Very
you for having
coming.
informative.
us.
Thank you both.
And it was a great show. My goodness, so much information. You guys are just terrific women, and we love promoting women. So today, it's all women. We're not raining men here today. It's the ladies. So on that note, I want to thank you, and I want everyone to know that we meet, we eat, and we seek at the Breakfast Club always. We are now considered PR in your pocket. And this show, that's my new thing, because when you come on this show, you're getting a video. You're going to be sharing it. People are going to see you. And 2 days from now, you share it again. That's called PR in your pocket at 1/3 the price of PR. So on that note,
That's a great
Stephanie,
idea.
I'm glad you came.
Thank you so much. I'm glad to be
thank you.
back in
Thank
the
you for all the
seat.
goodies. And I always give my guests a little something. So this
Oh.
is for you. You're getting a mask for
Thank
your
you.
eyes,
Thank you so
And
much. It's
perfume.
sweet.
and you're getting a mask for your eyes and perfume.
Oh.
And on that note, ladies, it's a wrap.
It's a wrap. Thank you.